Hi there, my name is Julia and I'm here to film my video for my level 1B experience. I was located at TriStar Skyline Trauma Hospital and my experience was truthfully a 10 out of 10 experience. I absolutely loved the hospital setting. I got to work in ICU care, rehabilitation, acute care, and I just thought that seeing all of the different diagnoses and the amount of different cases that I was exposed to was absolutely incredible. So hands down, amazing experience. So diving in, my first question about task analysis and critical thinking, reflecting on a time when I had to use task analysis. I'm going to start by talking about a stroke patient that me and my clinical educator had. So she was a right side affected stroke patient, and it was a pretty severe case. She really could not see much out of her peripheral view of her right side. So what we did with her was we ended up taking her to the gym, which had a kitchen, and we wanted her to find the red cone. We had a little red cone, and we knew that the red was kind of going to stand out, and that was going to be easier for her to locate with her eye. And so while we set up the kitchen, we had the patient, wait for us, and we really had to break down the task. We had to think, okay, so first of all, where is she going to be walking? What shelves or, what doors is she going to be opening up? Where do we need to hide this red cone so that it's going to be, we're going to grade it down for her because it was so severe that we did want to try to make it a little bit easier for her to find the red cone. So specifically in that situation, we really had to look at the task of, okay, we're going to take her into the kitchen, and what is everything she's going to be doing to find these red cones? So really breaking down that task to make sure that it wasn't going to be too challenging for her, and that she was going to be able to be successful in her therapy session. So that was one thing we did. Question number 2 about adapting tools and materials with a patient. So how did we ensure that the adaptations met the client's needs while maintaining safety and functionality? So we used a ton of adapting tools, which was awesome. First one was we used a sock aid. This was on my first day. We had a patient who had a pretty severe fall, and there was some lower body injuries, and they were having trouble putting their socks on. So we pulled out the sock aid. We were able to teach them how to use it. It did take them a little bit of time to get used to it, but that was really cool. We showed somebody how to use a sock aid. We used a sliding transfer board, which was so cool. We literally just learned about that in class. So that was a fun tool that we used with somebody who had an amputated foot. They could not get into their chair from their bed, so we placed a sliding board down for them. And then a leg lifter. We taught one man how to use a leg lifter to lift his leg kind of up and down off of his bed. So we used a ton of adaptive materials, and these materials all were to help the patient make their life easier, and help them, be able to participate in their occupations despite their injuries and their diagnoses. Okay, so environmental modifications. Talk about a time with a client who faced a challenge in their home, their community, and what did we do to, recommend or implement something to help them be able to participate more safely. we had a woman who was getting ready to be discharged to go back home. She had suffered a pretty severe fall, and we were very concerned about her getting up and down the stairs in her house. Now, luckily, her bedroom was on the first floor, so, you know, it wasn't too critical, but her husband's work office was on the second floor, and this woman was very, like, keeping her house clean and just like going upstairs, cleaning her husband's office. That was a very important thing for her to do. So we had to, first of all, we had to work on stairs with her. In the gym, there's stairs that we had to do a couple reps on just to make sure she was comfortable enough to get up and down the stairs. But then we did have to recommend that she try not to, at least for the first 2 weeks, go up and down those stairs, because we knew that it was going to be difficult for her to get up and down, and it was going to put her at risk of falling again. So the change that we recommended was, you know, try not to go upstairs to your husband's office to clean. Let your husband clean his office for those 2 weeks, and then once you are feeling stronger and a little more confident, then you can go back to going up and down those stairs. So that was that. All right, so psychosocial engagement. Share an experience where you observed how psychosocial factors such as motivation, anxiety, or self-confidence influenced a client's performance. Yes, so I got the amazing experience of being able to see a client use an overhead harness system to help him get back up out of his wheelchair and walking. That was really, really cool. Something that I noticed while I was watching him was he was so motivated and so excited to get out of his wheelchair, try his best, and to get back at it. So, you know, kind of comparing his experience to a couple other patients that I experienced who were not so motivated and were, you know, maybe fighting depression, anxiety, the differences in their performance is huge. I mean, this man, since he did show motivation and excitement, he was able to get up in that harness and walk back and forth at least 4 or 5 times, which is really impressive for somebody who, you know, is not able to walk and who's in a wheelchair. You know, he really got up and he did it. But we did have a couple of patients who, you know, we had to leave the room because they didn't even want to participate in therapy, whether that be because of, you know, maybe depression, anxiety, self-doubt. So psychosocial factors, that is it plays a huge role in whether or not the patient is going to participate in a therapy session. So yeah, the man who did the overhead harness did an incredible job. He got right out of that wheelchair. He was, you know, connected to the harness system that was up on the ceiling, and he walked back and forth with the therapist right beside him, like 3 or 4 times, and he was so excited and motivated. So that was awesome. So reflect on a time when a client's psychosocial challenges affected their participation in a specific setting. Yeah, what strategies did you or your supervising therapist use to enhance the client's psychosocial engagement and improve their performance? So we had a client who ended up, the first time we went into his room, declining therapy. And the first thing that I noticed when we were in his room was it was like pitch black, shades were closed, like it just had like a very dark vibe. He was in his bed, and just, I didn't see any family there supporting him. I just didn't see, I didn't see a lot of support. So I think he was probably very depressed, and he just had no interest in participating in the therapy session. So my clinical educator had to use her use of therapeutic self to try to encourage the patient to get out of bed and to try to move. And I really liked the way she did this, because it wasn't like she was begging him to participate, like she instead, she was really smart about it. She used her ability to banter and to joke with the client to kind of try to get him out of bed that way without begging the guy, and without, like she engaged him by using banter and comedy to try to get him out of bed, which I thought was really great. It unfortunately didn't work, but she tried. So at that point, we just kind of had to let it go. We can't force the client to participate. But that day when we went down to the therapist's office, we did have to kind of think about, okay, so what are some things that we're going to have to do to get this client up and moving? So what strategies did you and your supervising therapist use to enhance the client's psychosocial engagement and to improve their performance? What we did was we ended up teaming up with one of the physical therapists, because we knew that the physical therapist got along very well with the client who was refusing therapy. So we kind of used that strategy of, okay, let's team up with physical therapy. We know that he has a connection with this physical therapist, and maybe by having a teamed up session that's going to give this client more motivation, that might distract the client from his anxieties and his depression, and that'll maybe give him the push that he needs to get out of bed and participate. And it did work. When we went back the next day with the physical therapist, you could tell the client was way more engaged, way more excited to get out of bed and participate in our therapy session. Integration of knowledge across objectives. So let's see, describe a clinical case where you combined task analysis, environmental adaptations, and understanding of psychosocial engagement to develop a comprehensive intervention. What was the outcome? So for this one, I'm going to go back to the stroke patient that we had affected in the right side, that we used red cones in the kitchen to, help her get up and moving, help her using that right side, her affected side, to find things again. So for that intervention, we definitely had to use task analysis, breaking down the task of working in the kitchen. We had to adapt the environment. So we adapted the kitchen by, first of all, cleaning it up a bit. We had to make sure that it wasn't too cluttered and overwhelming for our client. We also had to move some stuff around. So we moved the table and the chairs around to make sure that she wasn't going to trip and fall over anything, and just make sure it was in the smartest position for her. And understanding of her psychosocial engagement. Now, this client was actually known for being, I guess you could say, a little too excited. She was a fall risk, and she was just getting out of bed without, using her call light. She was definitely very ready to get out of the hospital and to get moving. So when we were going to plan that intervention with this client, we had to take into account all of these things. So we understood that psychosocially, this client was a fall risk. She was very eager to get out of her chair. And we had to make sure going into it that, luckily, since I was there, I was able to keep an eye on her while my clinical educator set up the kitchen and, you know, prepared the environment for her. So the outcome from this experience was, I would say it was pretty solid. I feel like we broke down the task well enough that it wasn't, you know, too difficult for our client. Although we did have a time when she spilled an entire cup of water because she carried it with her right hand, which was her affected side, and it was very shaky and it fell, and we had to clean that up. So I would say if we learned anything, we learned what to avoid next time, or maybe what to work on. Maybe getting her a cup with like a strap-on handle. That way there's less risk of it falling. Maybe a cup that's lighter, because it was a glass cup. Maybe that was too heavy for her. So we did learn, okay, what could we do next time to avoid the spilling and the falling of the glass? So yeah, I would definitely say with this client, we needed to break down the task, we had to modify the kitchen, and we had to understand who she was psychosocially as a client to make sure that, you know, our intervention plan was safe, motivating, and really adapted to what she needed. So, once again, I cannot say enough amazing things about TriStar Skyline Medical Center. My clinical educator was Amber Kolb. She was fantastic, and I had a wonderful time at my field work. Thank you. Bye.